Bronwyn Fathom, and I'm a fourth-year medical student at the UNC School of Medicine, Asheville campus, working with the Mountain Area Health Education Center.
Hey, my name is Jared Sane, and I'm a third-year medical student at the UNC School of Medicine, Asheville, at the Mountain Area Health Education Center.
In this video, we're going to walk you through something that has been affecting all of us, the COVID-19 pandemic. From going to the grocery store, to attending school, to visiting your grandparents, it's changed the way we do everything. There's a lot of information out there about this virus that has traveled around the world. Some of it is true, and some of it is false. So in this video, we're going to walk you through what's truthful and what's important to know about this virus so that you can stay informed and take precautions to stay safe during this time.
COVID-19, coronavirus, SARS-CoV-2, what is it, and what do all of these words mean?
So let's break it down. A virus is microscopic and much smaller than a human cell. It requires a living host, like an animal or a human, to make copies of itself. And in doing so, it makes the living host, like a human, sick. There are hundreds of thousands of viruses in the world, and they cause a wide variety of human illnesses, from the common cold to warts to the flu.
True or false? The COVID-19 pandemic is a hoax, and the number of reported cases is greatly exaggerated. False.
For the vast majority of scientists, teachers, and citizens across the United States and the world agree that the coronavirus of 2019 is a new virus causing real illnesses and deaths around the world. Each country is dealing it with its own unique way. And in reality, the fact that we didn't have testing available months into the pandemic likely means that the number of reported cases is actually underestimated, and there are likely many other unreported, more mild cases of the illness that we don't know about. To many who study viruses and disease outbreaks, this current global pandemic was inevitable and expected to happen with a population as big as ours. Future pandemics are also expected to occur, so it's important that we learn about this one now so we're better prepared for the future.
True or false? The current viral pandemic is the same as the flu. False.
While influenza and the current viral pandemic are both due to viruses, remember, they're different viruses and they have different impacts on human health. They have different courses, different symptoms, and different treatments. And of course, they require different vaccines. One reason this viral pandemic is so different is because it's new. So we don't have vaccines or bodily defenses available yet to help us fight off the virus.
True or false? There have been other coronavirus outbreaks and viral pandemics in the last 20 years. True.
Coronavirus is a family of viruses, and it contains different viruses that have been getting humans sick throughout history. Most recently, there were coronavirus outbreaks in 2002 and 2012 due to different coronaviruses. These didn't cause as many illnesses and as many deaths, and so we didn't hear about these viruses quite as much as the current one. The outbreaks in 2012 and 2002 were different than the current one because those viruses were shaped differently and had different abilities to infect and hide in human hosts.
True or false? Bats carry viruses like rabies that can make humans and animals sick. True. It has long been known that bats carry many viruses, including coronaviruses, and they can infect humans with these viruses. You've probably heard of the rabies virus, a deadly virus that bats can transmit to humans and animals like raccoons, dogs, and cats. If you have any pets, they have probably gotten a rabies vaccine to prevent them from getting the illness.
So this animal-to-human transfer is exactly what happened with the SARS-CoV-2 virus last year. It was probably transmitted from a bat to a human, and then from human to human until it eventually spread around the globe. Diseases that originate in animals and then infect humans are called a zoonosis. You can remember this by thinking of these diseases originating at the zoo, where there are lots of other animals. What about the phrase COVID-19, which you probably have heard said a lot more frequently than SARS-CoV-2 or the coronavirus? Well, remember, the coronavirus is the family and SARS-CoV-2 is the new virus. When SARS-CoV-2 infects a human and they get sick with an illness we call the coronavirus disease of 2019. And you guessed it, when that shortens, it's COVID-19.
So let's recap. Coronavirus is the family name, and SARS-CoV-2 is the name of the newest virus in the family causing the current COVID-19 pandemic.
Now let's talk about how the virus is spread and how to practice good hygiene to prevent spreading the virus. The virus replicates very successfully in the cells in the back of the nose, mouth, and throat, and is spread through small droplets of saliva and mucus when a person coughs, sneezes, or talks. It can also be spread when a person touches their eyes, nose, or mouth, and then touches someone else or contaminates a surface. There's even some research that shows the virus may be spread through the air. Spread and transmission of viruses through respiratory droplets is a common mode of transmission. For example, rhinoviruses that cause the common cold and influenza viruses that cause people to get sick every fall and winter are also spread in these ways.
Keeping this in mind, what are some methods you have used to prevent getting sick or spreading viruses? True or false? Face coverings and masks reduce the amount of oxygen you have and are actually dangerous. False. True or false? An appropriate mask is a simple and effective way to reduce the amount of viral particles that you release into the environment. True.
As I said earlier, the SARS-CoV-2 virus likes to replicate in the cells in the back of the throat and nose. So the fact that coughing is a major symptom of COVID-19 helps the virus spread from person to person. That is precisely why wearing a mask is so important. Though masks may be unfamiliar and uncomfortable to some, masks do not reduce the exchange of oxygen and do not affect the amount of oxygen your lungs are able to breathe. Construction workers, factory workers, and healthcare workers are all used to wearing masks for various reasons. However, the type of mask you wear does seem to make a difference. And recently, Duke University conducted a simple science experiment to test the efficacy of different masks. They found that most masks do reduce the spread of droplets from the mouth and nose, except for thin, single-layer masks that wrap around the neck, called neck gaiters, fleece masks, and masks with one-way valves. In the end, 2- and 4-layer cotton masks and surgical masks are most effective. Because people may be able to spread viral particles before they are sick, wearing a mask is an easy way to reduce your spread of your own potentially infectious particles before you know you have the virus. Other than wearing a mask, there are 2 other key actions to take. One, you're used to. It's washing your hands. Thankfully, the virus can be easily killed with soap and alcohol-based hand sanitizer gels and liquids. So wash your hands for 15 to 20 seconds and do it frequently throughout the day. Every time you go to the bathroom, before you eat, and after you go out in public. The last thing you can do is to maintain appropriate social distancing of at least 6 feet between you and other people. This is important because COVID-19 spreads mainly among people who are in close contact for a prolonged period of time. Maintaining social distancing, wearing a mask, and washing your hands are all easy, harmless actions to take to prevent the spread of this virus. So now that you know why it's important to wear a mask and that masks are not dangerous, and also why it's important to wash your hands and maintain social distancing, let's talk about the other symptoms of COVID-19 as listed by the Center for Disease Control. Symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Clearly, this is a long list of symptoms, and it is not possible to know if someone has the SARS-CoV-2 virus from symptoms alone. Testing is needed in symptomatic individuals to confirm or deny the presence of the virus. Even in individuals who are not symptomatic, they could possibly still be carrying the virus. So it's important that if you think you've had close contact with someone with the COVID-19 illness to quarantine yourself for 14 days, regardless of whether you get tested or not, because you could potentially have the virus and still be infected.
Because COVID-19 is spread through respiratory droplets and possibly the air, there are several things you can do to reduce your risk of transmission. You can wear a mask. You can avoid enclosed spaces with many people. And you can also limit your contacts in order to reduce your risk of becoming infected. If you can't avoid others due to public transportation needs, work, or living situation, there are several simple steps you can take to reduce your risks. You can wash your hands, avoid touching your face, and wear a mask.
As well as these key actions to prevent spreading the virus, it's also important to embrace empowering dietary choices by eating fresh foods, exercising when possible, socializing with appropriate social distancing with friends and family, and continuing spiritual activities that make you feel emotionally and physically well during this time.
Most individuals that contract COVID-19 will have a mild illness, but if they do end up having a severe course and wind up in the hospital, about 1 in 20 patients die. If you're over the age of 50, this risk increases. And if you're between the ages of 70 and 80, your risk increases even greater. Individuals with other health issues like asthma, obesity, high blood pressure, kidney disease, and diabetes are all at higher risk of having a severe disease course.
As of making this video, there have already been over 7 million reported cases of COVID-19 in the United States and over 200,000 deaths. In North Carolina alone, we have had 196,000 cases and over 3,300 deaths. Many deaths and illnesses have likely been prevented due to the quarantine and shutdown measures taken in the country and state since March. However, these measures have had their own economic and physical impacts on millions of Americans, including families and individuals across North Carolina.
True or false? Unique factors like where we live, if your family has transportation, if you experience racism on a daily basis, or childhood trauma can all affect your physical health and your mental health as well. True.
It is important to keep in mind that individuals and families that have less access to resources like housing, food, and transportation, and who face increased social stressors like joblessness, racism, sexual and gender discrimination, and interpersonal violence, face increased physical and emotional burdens that increase their vulnerability during a pandemic like this. Furthermore, people with specific jobs or personal circumstances that prevent them from being able to stay isolated at home are at increased risk of getting sick because they have to spend more time out in public around people who could potentially get them sick. People of color in indigenous communities like Latinx, Native American, and African American communities in the United States have faced higher rates of severe illness from COVID-19 and higher rates of death. This is likely due to complications and interactions with societal factors that are out of these communities' control.
How have you and your community been affected by COVID-19 and the country's shutdown?
It is important to recognize the many indirect effects that this pandemic has had on our communities, from the closings and shutdowns and quarantine measures taken across the state since March. These measures have affected things like employment, housing, chronic disease, people's ability to obtain health care, and even spend time with their friends and family. Poverty, chronic disease, climate change, and racism are also other examples of widespread issues that affect millions of Americans and coexist with this current pandemic. We are seeing the effects of multiple circumstances interacting to create particularly dire situations for many.
The direct impacts of the virus are made worse and harder to bear by the unique obstacles that face each person and community. Not only are people worried about getting sick from the virus, but millions of Americans struggle to pay bills, find jobs, maintain housing, fight off depression and anxiety, and try to maintain connection with friends and family. Despite these life-changing and unprecedented times, our communities are resilient and will continue to learn how to adjust. Do not hesitate to reach out to a friend, a family member, a counselor, or a doctor for physical or mental health support during this incredibly trying time.
Thank you for spending time watching this video and learning more about the COVID-19 pandemic. This new virus, our country's response, and what we are learning about this pandemic will affect our lives for years to come. We will see downstream effects from this virus and this pandemic long into the future. We hope you will take this time to learn more about yourselves, your loved ones, and community members, and the obstacles we are all facing together despite being physically apart.
We got Leichin in and Grace.
Tasha. There's Ella. Okay, is that everybody? I think it is.
Yeah, I think so.
Jennifer, Grace, Ella, Tasha. We're waiting on Abigail. Are you going to join Abigail? All right, guys, these only have 10 seconds. So you have to answer pretty quick. So the question was, how many COVID-19 vaccines are currently available? You all are pretty smart. So there are three. There's two that are available. Johnson & Johnson is currently in their phase 3 of trials. And we will go on to the next one. There's our leaderboard. Ella coming in. This one's worth double points because it's tough, which is not a producer of current COVID vaccine. Oh man, y'all are sharp.
Yeah, good job.
So yes, Procter and Gamble have not developed a COVID vaccine, but of course we have Pfizer, Moderna, and Johnson & Johnson. Ella's still in the lead. Oh man. Y'all must watch the news a lot.
These kids are competitive.
They are. So the COVID-19 vaccine is indeed more effective than the flu shot. So to put that in perspective, in 2020, the flu shot efficacy was only 45%. So Moderna and Pfizer are both 94 and 95% effective for efficacy. That's pretty good. Uh-oh. Ella, you failed.
Get ready.
Yep, so this one was all the above. So a lot of people said, how was the COVID vaccine created so quickly? So scientists from all over the world were working together for this common vaccine. There was a lot of teamwork. There was also what people didn't understand or don't understand is that there was a ton of previous knowledge about the coronavirus. So scientists have been studying the coronavirus for the last 50 years. So what they were doing was looking for this specific strand of COVID-19. So they took all of their previous research, did a little investigation on the current strand, and come up with a vaccine pretty quickly.
There you go, Grace. Move back up. Y'all are smart.
Everybody got that one. So yeah, COVID-19 vaccine, both Pfizer and Moderna, have been seeing some side effects. Most people on the first one are just getting pain and kind of redness in their arm. I've had Moderna shot. I think Amy has had the Moderna shot.
I have.
My arm was a little sore and that was it. So the second shot is the one that's causing people usually to have the fevers and chills, the headaches, the tiredness. But it all usually only lasts about 24 hours and goes away. Grace is still in the lead.
Grace is holding on.
She's on fire. It's a tricky one. Oh man, y'all are good. So yeah, we don't actually know how long the current vaccine is going to protect us. That they're saying they're working on some boosters to develop. They're hoping that it lasts a year. But there's really a lot of unknowns and a lot of uncertainty still around the vaccine. This should be the last question coming up. Factor cap. It's false. So when the vaccine first came out, a lot of people were saying that you could get COVID-19 from getting the vaccination. That's simply not true.
Good job. If we were with
Right.
the person, we give you a prize.
Hey, the date's right. It's a miracle.
The date, first time. It's a miracle. Guys, we have a workshop scheduled next week for family nurse practitioners and physician's assistant. And we are still working on that. We hope that we'll be able to have that workshop for you next week, but we've had some glitches. So if we aren't able to have that workshop, we'll let you know. But if you are scheduled to be there, yeah, just show up unless you hear from us otherwise.
Fingers crossed we can find someone. Had a couple presenters who have kind of flaked out.